You know those important decisions you need to make, like whether or not to jump off the roof like it's a WWE match, or smashing your head into the boards during your hockey game, and listening to your dad or coach who love to quote Taylor Swift to tell you to shake it off. 'Cause what can go wrong? Hey guys, I'm Anya, and this is a new series I'm starting called What Can Go Wrong. It's a series where I'm going to be explaining different situations, whether it's trauma or medical. My motivation to do this series is because I'm studying to be a paramedic. Doing these videos will not only help me study, but I also hope for it to also help my classmates or even you. I thought I'd start off this series by starting off doing a head and then make my way to the feet, so head to toe style. So today's episode, we'll be starting off with the head. Starting off with trauma. Trauma can get pretty repetitive. So let's get these definitions out of the way of different trauma injuries, which are contusions, lacerations, abrasions, penetrations, fractures, and then for the head, the worst of all, decapitation. The collapse was just meant for inspection, which is the injuries that are obvious to the naked eye, and then there's tics, what are things that we need to palpate for. So starting off with the letter C, we have contusions, which essentially are bruises. It's when blunt force trauma damages and breaks blood vessels, causing blood to leak into the tissue, then making a discolored, gross bubble underneath your skin. Keep in mind that you can also bruise your organs which aren't visible to the naked eye. For example, concussions. A concussion is when you cause trauma to the head, either by getting a blow to the head by maybe a baseball bat, or being violently shaken like in a car accident. Not all concussions can result in a person having loss of consciousness. The person can appear confused, dizzy, nauseous, or even have a headache. Most people brush these symptoms off thinking, hey, that's what happens when you hit your head. But if you don't treat a concussion properly, it can lead to severe complications. Now, don't be worried about giving your head a shake now because you think you're going to give yourself a concussion. When I say violently shaken, it has to be pretty severe. Like, depending on the speed you're driving at in a car accident, the impact from your brain colliding with your skull is what I'm talking about. In my program in French, we call that a coup contre coup. That could be whiplash in English, maybe? But you know when you get like pushed from behind and you have that neck jerk? If someone pushes you hard enough, or you get in an accident at a fast enough speed, you can really do some damage, bruising to your brain, possibly even causing your brain to bleed. Next, we're going to L, laceration. It's essentially a cut, whether it's big, small, shallow, or deep. This can occur when working with knives, tools, falls, or even car accidents. Clean the wound with sterile water, bandage it up, keep good pressure, considering head wounds do bleed a lot. If the wound is on the neck, do not, I repeat, do not tourniquet someone's neck. You can use your hand and put the pressure on it. Now for the letter A, abrasion. Abrasion's pretty much road rash. It's rough, it hurts, it burns, and it's really hard to clean. Best thing to do for that is take some sterile water, have them hold the wound downward so that the water drips down along with any dirt or rocks that may be in it. Letter P, penetration. Let's go with penetrating injuries, because you guys have some nasty minds out there. Penetrating injuries. It is when a foreign object breaks the skin or bone into the body. Do not remove the object. Removing the object can cause more bleeding or possibly more damage. The best thing to do, immobilize the object and get them to the hospital ASAP. Moving on to fractures. This would involve bones that'd be broken, whether they're small, simple fractures or protruding fractures where the bones are sticking out of the skin. And the last one I said was decapitation. Are you okay there, sir? Huh? Yeah, I think he's dead. I think so. Now off to do the medical patients now. Remember, you guys, currently a student, not an expert. If I say something you think is wrong, don't be mean about it. Starting with stroke. There are two different types. Ischemic and hemorrhagic. Ischemic stroke occurs when a thrombose, blood clot, or emboli causes a lack of oxygenated blood to circulate properly in the brain. A hemorrhagic stroke occurs when one or possibly many blood vessels leak or break entirely in the brain due to things like hypertension. Going into some anatomy here. There are different layers surrounding the brain that are called meninges, and they are called dura mater, arachnoid, and pia mater. So blood can also accumulate in these 3 different layers, causing pressure on the brain, and this would be what would be causing the hemorrhagic stroke. This can start off as a simple call of a bad headache and escalate to trouble speaking or seeing, trouble walking, paralysis, and even numbness. The common symptoms of the stroke are the droopy face, slurred speech. Do not give stroke patients aspirin, because if it was a hemorrhagic stroke, would it not be beneficial to the person that their blood would be able to clot to prevent any more blood from accumulating in their brain? Yes is the right answer. Moving on to a different type of stroke is called a TIA, which is also known as a mini stroke. This is a stroke, but it lasts less than 5 minutes, which can mean different things, so go see a doctor. Another common type of stroke would be heat stroke. Heat stroke does not have the common stroke symptoms. Instead, the person will have hot, dry skin, no sweating, nauseous, headache, fast respirations, fast heart rate, and all of it because they put themselves in an environment that raised their body temperature to over 40 degrees Celsius. Heat stroke patients need to be cooled down immediately. Get them to an air-conditioned building or even shade. Cold water. Do not give them anything sugary to drink, or alcohol either. No alcohol. And they need rest. Something I also learned in my program is how easily a stroke patient and a Bell's palsy patient can be confused. Bell's palsy has similar symptoms, meaning they have the droopy face, slurred speech, but it's only their facial nerves that have a problem. They can still walk, they can still use their arms, so that's one thing to keep in mind, is to make sure you do your full neuro test so you know whether it's a stroke or Bell's palsy. Oh boy. And that was all stroke. How about brain aneurysms? An aneurysm is when the wall of a blood vessel is weak. So blood will accumulate there, causing a bulge or bubble on the vessel. The bigger the aneurysm, the more fragile it'll be. These people would present with symptoms like a headache, poor vision, and droopy eyelids. You'll notice a pattern where headaches equal bad. If the aneurysm ruptures, the person would become nauseous or even go into a seizure. Need to put my serious hat on right now. How to avoid getting a brain aneurysm. Don't abuse drugs. Don't abuse alcohol. And don't damage your head. It's precious. But other causes could be medical history, possibly in your family, age, smoking, or hypertension. By the way, if you guys don't know what hypertension means, it's another word for high blood pressure. If you didn't know, high blood pressure means bad. Moving on to AV malformations, or atriovenous malformation. The disruption of the vital process where deoxygenated blood should be returning back to your heart and lungs to get reoxygenated. It's a cluster of vessels in your brain that aren't oxygenating your brain. It's something you're born with, so you won't really know unless you actually get it checked. But less than 1% of the population actually is born with an AV malformation. The reason why these AV malformations are so dangerous too is because they can easily rupture. The vessels are very weak. The chances of the vessels rupturing vary between 1 to 3% every year. So after a period of 15 years, your chances of the vessels rupturing have reached 25%. People with AV malformations don't live long lives. They usually rupture when they're in children or young adults. The rupture will cause a hemorrhage, then putting pressure on the brain, causing the person to have a headache and then go into seizure and then worse. In paramedic terminology, this situation is a load and go. Encephalitis and meningitis. Encephalitis meaning inflammation of the brain, and meningitis meaning inflammation of the meninges. These are typically caused by infection. These patients will either have a headache or a stiff neck, have a fever, or even have seizures. These patients need to see a doctor so they can be prescribed possibly antibiotics to beat the infection before it gets any worse. The inflammation can also be caused by a virus such as HIV, mumps, West Nile, which will take more than antibiotics to beat. Seizures and epilepsy. There is a difference between them. Starting off with seizures, there are different types and different phases. But let's kind of just stick with general seizure symptoms and so yeah. The general seizures consist of different phases. Hint, hint, you need to know the phases. The phases of a seizure are aura, loss of consciousness, tonic phase, hypertonic phase, clonic phase, post-convulsion, and post-stictal. I'll leave you with this little homework to find out what each phase consists of. Seizures are usually a one-time occurrence that are provoked by things such as low blood sugar, electrolyte imbalancements, alcohol withdrawal, drugs, or a high fever, also known as a febrile seizure. Now, this is where you guys will see the difference. Now, epilepsy is a brain disorder where the person will have unprovoked seizures, where they usually have medication that they take on a regular basis to control them. Usually people associate epilepsy with the people that can't handle flickering lights, which is called photosensitive epilepsy. Photosensitive epilepsy affects a small percentage of people with epilepsy, but it's still always good to be cautious. So if you still didn't notice the difference between epilepsy and seizures, just think of these words: unprovoked, provoked. The last thing I want to talk about in this episode, vaguely, is brain tumors. Since tumors can be cancer related, if you guys are interested, comment down below if you guys are curious to see a video on cancerous tumors or cancer in general. But for now, just know it's an abnormal mass of cells that are accumulated in the brain. The growth of the tumor will cause intracranial pressure that needs to be monitored, because what can come with intracranial pressure? Headache, nausea, seizures, as well as trouble with speech, sight, and hearing. The brain is a complex organ, which doesn't only include all the trauma and medical problems I just talked about, but it also includes other topics such as depression or dementia. Let me know in the comments down below if you guys are interested in me making an episode on the psychological aspects of the brain. I probably won't go as in depth as a psychologist in that psychology world, but I will be encountering these kinds of people, and I also need to be respectful of their challenges. So for now, we're going to end this today, because holy moly, we went over a lot. Today we talked about trauma situations like contusions, lacerations, abrasions, and penetrating injuries. CLAPS is an acronym that we were taught to use on how to inspect the injuries of a patient. On the medical side, we saw stroke, brain aneurysms, AV malformations, epilepsy and seizure, meningitis and encephalitis, and briefly brain tumor. A reminder, do the homework, find out what those seizure phases consist of, and I would like for you to put your answers on the Anya Laliette Facebook page. I'll have the page linked in the description down below. I'm interested to see what you guys come up with your answers, and I will put my answers down by the end of the week for you guys to see. So again, I hope this helped. I know this is going to help me because I'm trying to do my best to make sure everything I tell you guys is correct, because it's going to be really crappy if I'm wrong. If you enjoyed this video and it did help you, please give it a thumbs up and share it with your friends and classmates that you think that it would help them or interest them. Thank you so much for watching, and I'll see you guys in the next one. Bye! Oh, I'm probably going to go watch this after I graduate and correct every little word I say. I hope not.